I've got here, one later on. Oh, no, then, anytime I was going through, but then I said that.
Okay. Yeah, not too bad, thanks.
My cousin, she's seen
We should wait 2 more minutes if it's okay. I don't
Your Christmas tree.
Can you hear me, Mom? Yeah. Just reach in.
All right. There are 2 seats up here.
Oh, there are 2 seats.
Yeah. Cool, guys. I think there might be some people late, so they can just jump in the back. Before we start, I'd like everyone to just grab their own ear and just pinch it until you feel some pain. Anyone? Now, how many of you, show of hands, felt some pain or discomfort? Thanks very much. Just jokes. My name is Kieran. I'm a chiropractor in Blackfen Chiropractic just down the road. And today's talk is about pain and just what pain is and how you fix it, not necessarily what you do to fix it, okay? There's many different types of treatments, but today's about understanding just what pain is and how it is fixed, not necessarily what to do to fix it. Let's start off with a story about my dad. So we're from South Africa, and my dad played semi-professional rugby for pretty much his entire life. He played from the age of 5, and then from like age of 12, he was playing provincial rugby. He's the ultimate man. He taught me everything I know. So one of the games he was playing, he ran, and he took a tackle and went down. So let's just pause there. And what happens in that instant is fast fibers shoot straight to the part of the brain called the thalamus, which is like the Amazon center. And then from there, it distributes to the rest of the brain. And it shouts to the brain and says, Wayne, you've just been touched on the front of your leg. And a few milliseconds after that, pain fibers go to the spinal cord, from the spinal cord to the thalamus, to Amazon. And then from Amazon, it speaks and it says, Wayne, there's just been a sizable pressure to the front of your leg, and we should probably assess that. So then that part of the brain speaks to the rest of the brain, and it says, what's happened here? And the rest of the brain says, well, we're on a rugby field, we've taken a few tackles, we've been doing this for the last 20 years, this is completely normal. So the brain does nothing. And my dad steps up, and on his second step, his leg falls in half. He's broken his femur. Okay, true story. 30 years later, we're hunting, and the truth about hunting is that you have to keep quiet. Like you stalk the animals. And my brother, dad, and my brother and I hear my dad screaming on the other side of the valley. So we run over to my dad, and I beat my brother because I'm faster than him now. And we get to my dad, he's clearly broken his leg. So my brother's an orthopedic surgeon, true story. And we splint my dad's leg. My brother takes the femoral pulses to check he's not dying. And we rush my dad to hospital, the hunt's over. So we get straight into the MRI machine. So let's pause there again. Okay, so what happens is my dad's walking, he falls into a warthog hole, massive hole, hits the front of his leg. And in that moment, touch fibers shoot straight up to the base of the brain. Amazon's like, Wayne, you've been hitting this, you've touched something on the front of your leg. And milliseconds after that, the pain fibers arrive, spinal cord, Amazon, Wayne, we've just had a sizable trauma to the front of our leg. Then the brain speaks to itself and it says, has this happened before? And it's like, yes, the last time this kind of pressure happened, our leg broke. So the brain says, let's cause as much pain as possible. Okay, so that describes how pain works. Pain is protecting something. my dad comes out of the MRI machine and he's got nothing wrong with him. He simply had a dead leg. But the dead leg was enough for the brain to pick it up as a trauma and it caused agony. So that is what often happens with pain. So we'll see that today. I'm going to try and summarize 6 years of medical school for you into 4 sentences, okay? So let's try that. So if we take away all emotion, thoughts, fears, all cognitive thoughts, our brain is simply a ripe avo. So there's the brain in the head. Take it out. It's just a nice, soft, squishy avo. Okay. So the brain is encapsulated in your skull, and it is always adapting throughout your entire life. Your entire life, the brain's always learning something new, always. Whether you're 5 years old or whether you're 8 years old. And within the brain, you have all these kinds of neurons and cells, and they just all speak to each other. Okay, so your brain picks up thought as a certain way that those pathways run through the brain. Okay. After the age of 5, they're pretty much there, but you can change how they speak to each other by changing some pretty cool, groovy things in the brain. So that's what the brain cell looks like, and it's got all these little feet that spread over to the whole brain. And the last thing about medical school that you have to know is that the brain is always trying to pass off things as reflex. So eventually, once your body's learned the pain response, it doesn't have to worry about that anymore, because the pain is there to protect you. And the brain doesn't think about it again until it becomes an issue with chronic pain, which is why I think most of us are here today. So pain principles, when you go through about 8, just facts about pain. Number 1 is pain is always real, no matter what is causing it. So no matter what is causing it, the best definition of pain that I've heard is that pain is whatever the patient says it is. Okay, because it is all relative. I squeeze my ear, that could be excruciating for someone, it could be no pain for someone else. So a good friend of mine gave me permission to share this picture. Her name is Adrian. You can see. She's an amputee. So her right leg's off, just below her knee. And she phoned me, she's like, Q, I'm getting pain in my right foot. That's not there. Okay, so it's real, and she said, Q, it's under the arch of my right foot, and she's got no foot. So there's an example that she could literally feel real pain in something that was not even there. So we treated her other foot with a mirror. So we put the mirror there, and we treated the left foot, and her brain saw the right foot. And I only ever saw her once. And I thought she wasn't coming back because it's expensive or something. But she said, Q, I'm fixed. I'm like, it's impossible. Like, you've had this pain for like a while. She said, no, I am fixed. So you get these miracle sessions every now and then. Not everyone responds that quickly. But it's just a cool case that you get pain in something that isn't even there. The next example, this is from the British Journal of Medicine. Builder fell off a roof, lands with a nail straight through his foot. Bang. Gets rushed to hospital. There's the boot. He's in agonizing pain. They give him all sorts of medication, opioids. Nothing helped his pain. He's screaming blue South African murder. And they cut the boot off with surgical stuff, and the nails missed everything. It's gone straight through his toes. Okay, but he's had pain that pain medication isn't even blocking. So just an example of how pain can sometimes be in your head. In America, they get students to volunteer for tests, probably for extra grades or favors or something. And they put this thing on and they say that there's a dial, and they're going to turn the dial and it's going to cause headaches. And they had some people with actual magnetic pressure and some people with nothing. And the results came out, and everyone who saw the knob going up said, I have pain. Even though some people, the machine was just nothing. Okay, so cool experience. Doesn't mean much, but it's pretty cool. I drew this on my computer, and then we draw the next slide, which is the lines bowing over it. Can you see how like the lines do look like they're bowing over? Then we take away the other lines and they're just straight. Okay, so it's a cool visual illusion, right? But you can trick the brain to learn certain things. And this one's pretty cool. There's a checkerboard. Block A and block B are the exact same shade of grey. I mean, it doesn't look like it, but if you move them across, if we block out everything else, that is the same shade as that. But our brain has picked up the checkerboard and does some groovy things in the head. And next thing we see those different colors as different, but they are the exact same. If you turn your head to the side and look at it, nothing changes. I got everyone except Graham. Number 2, pain needs an environment. Do you mind me mentioning your name? So I've just seen a new patient and she's come with, because I think I helped her a little bit maybe. We spoke about how pain has an environment. So sometimes the environment could be stress, or your boss's name, or your cell phone screen, or the smell of your office, or the angle of your chair, the angle of your neck looking at your screen. There's so many different triggers that can sometimes trigger chronic pain. So before you even experience anything, you can actually be in pain already because of that, how that brain circuit just learns a certain reaction to a small trigger. So in Australia, they did a study. They got some normal people to volunteer for a pain study. They aren't normal because they volunteered for a pain study, but they had the hands like in a box, and they had an ice cold rod, freezing cold. And they put the cold rod on the skin, and at the same time they showed a red light or a blue light. And 100% of every person who had that test done, when they saw the red light, they experienced more pain. When they saw the blue light, they experienced less. So again, it doesn't mean much, but it's just a cool thing to see how there's often an association or an environment for pain. We already touched on the offices and the certain triggers. But yeah, I find a lot of patients sometimes by 9:10 in the morning, the brain's like, listen, we've been here before. So before 5 p.m. at 9:10 in the morning, everything's tight. Because it just knows it's going to be doing this the whole day, or this the whole day, whatever your trigger is. Pain is all about protection. Number 3. From when you walk into our practice, we're judging you hard. You know? We're watching how you walk, how you limp, how you bend. Because that's an involuntary thing. The brain is getting signals, and the brain is avoiding certain movements. You may recognize some of these when you've twisted an ankle. What happens? You start to limp. We may start seeing in about 5 minutes' time some people sitting in the chair, you know. There's just an involuntary change of posture because there's a trigger for the pain. So that's just something to understand. Number 4, pain and actual tissue damage are poorly linked. Probably the best example I can do for this is actually a visual one. Example 1. Who's scared of needles here? If I stick this needle inside of me, is it going to be sore? Probably, no.
I'll let you know, I'm having your booster tomorrow.
So we can find the trigger points in the muscle, and we can stick a needle straight into it. I felt nothing there. Should we just leave it there for the talk? Or you can. It's fine. So it's there. The point is, some people have a phobia of needles. Some people might throw up because of a visual trigger in the brain. Yeah, interesting thing. It's not sore. We can even do that to it. We can jab the skin a bit like that. That's absolutely nothing. Please don't pass out. And it's gone. So that's just a cool experience. So tissue damage, you can see I was damaging something, but there was no pain. In research, there's a journal called Spine. That's like the chiropractor's dream. It's all the research about pain and just the spine. They did a study, saying Sean, I'm bleeding. Did a study and they x-rayed and MRI'd people with no pain. And they found alarming rates of wear and tear on the discs and spines and just everything. Alarming rates. But they have got no pain. So we see patients, and mostly men are wimps. So guys will often scream for nothing. And often moms and ladies have got high pain thresholds, so they just don't complain. But the high pain threshold group is worse because there's just no alarm bells. So some people may come in for not much, but it helps because they then long term are going to be doing something for their health. But some people, do you mind me mentioning? Susan's had pain for 15 years, dull aches. No one's taught her about her back yet. Or there hasn't been an alarm bell for her to see someone because it's been dull aches. Turns out she's got a high pain threshold and she's got some boo things happening as well. So that's just something to be aware of. Number 5, movement, not medicine, is medicine. Just a side note, my brother's a surgeon, as I said earlier, so nothing is against any healthcare professional. Everyone works together, we're all in bed together. But from chronic pain management, sometimes drugs isn't the only answer. And again, this is now research that came out last year, done by Physiotherapist University, and they just said straight, opioid analgesia have small effects on persistent pain, but that's the first line treatment these days. So it just is what it is. It just is how the system is, but there is always something else to be done. Hopefully you can learn that today. I'm quite passionate about movement. I wrote a book about it, but that's a different talk for a different day. But the bottom line is that movement helps almost everything, right? Movement will help your chronic diseases. Getting yourself moving will just help your pain. It'll help learn new pathways in your brain. It will help your body forget the triggers for the other pain. So yeah, movement is pretty good. So one of our goals as chiropractors, my colleague Ingrid's here, one of our goals of chiropractors is just to get people moving again, you know, because the spin-off of that is huge. Number 6, pain is a disease. So it's obviously a symptom, but sometimes it becomes a disease. So Stanford doctors did some brain scans in people with chronic pain, and they found that it's very similar to things like depression, chronic depression. Pain is very similar to things like fear. Pain is very similar to cancer in just how the body responds. You know, so there's a thing called sickness behavior. When you have man flu, which is serious, you know, you feel so down and you just feel lethargic and don't want to shave your face and all these weird things happen, but it's the body, it's the brain saying, hey, relax, we are sick, we need to get better. And it's a problem when that happens when you're in pain and the answer for your pain is movement, but you just don't feel like movement. So that's just an interesting one. Number 7, inflammation makes everything worse. Without inflammation, we would all be dead because that needle would have killed me because there's no inflammatory response. So inflammation is what heals everything. But when it becomes too much and you're eating foods that are just overloading the inflammation, what happens is that the pain sensors become very sensitive and you can have a trigger from almost nothing. There's a few cool cases where people were just blowing on the skin, excruciating pain, because the sensors became so sensitive to the pain reaction. So a big part of what we do is just recommending good, clean eating. It's a talk for a different day. Number 8, things get worse before they get better. Not always the case, and hopefully never this bad. But often when we treat patients, we explain that sometimes the day after, the same day, or the next week, something's going to be sore. It could be the same area that we're treating because we've inflamed it a bit, but it could be something else completely. It could be the neck because you're now sitting differently, you're moving differently. Something else often wakes up, and it's just the brain learning those new pathways. So things often get worse before they get better, and then some people just almost stop when it gets worse. You know. So my little classic saying is, you have to get through some sewage before the clear water. You know, if you just sometimes fake it until you make it, and just keep going until you get to the less pain response. So, what can you do for your pain? Today we're going to teach you how to fix your pain, not what to do for it. But the answer for pain, according to the research, is the biopsychosocial model. Okay, this is my brother on the bed, the one with the red shirt, and there's us hunting. My brother's the cleverest person that I know. He's an orthopedic surgeon. Surgeons and doctors fall under what they call the biomedical model. Okay, without them, we would all be dead, because you break your leg, you're dead if you don't get it fixed. Okay, if you have a bacterial infection and you don't get an antibiotic, you're dead. Okay, so biomedical model works well when there's one cause of something. You know, one broken leg, one bacteria, one virus. It's amazing. Okay, but what the research suggests is that sometimes for pain you need to look at every factor. You know, because there may be something else that will trigger fear or something else. So the answer for chronic pain management is like what they call a neural re-education. You teach the brain what normal is. And this is actually, if you think about it, what all physios, chiros, osteopaths, massage therapists, this is what like everyone actually does, you know. You're working the body, or exercise therapists, you're doing stuff to teach the brain something new, and eventually that becomes the new pathway and the pain goes away. So we're just trying to trick the brain, you know, like that checkerboard. So neural re-education offers a hope, but there's a catch. Okay, the hope is that you can change. Like, it's a fact. I think I've spent my entire life doing this stuff. I've seen some pretty cool cases, and it really is true. You can change, but always a but. It takes time. If there was a quick fix, I always say this: if there was one session fix, I'd be the richest man alive. So I charge a lot of money for it. But there isn't a quick fix for anything. There's just long-term stuff, which we're going to touch on now. So to better understand how this happens, we can touch on a few brain concepts and how the brain changes. So the first of those is you have to be incremental. Everything you do has to be small steps, you know? One small step, one small move, one glass of water. It all starts with one of something. And then you build confidence in doing a bit more. The first guy who proved this was a guy called Erik Knudsen. And isn't that the cutest owl you ever see? They put prism glasses on this owl and they skewed its vision by 7 degrees. And they cued a cue for food, and it knew, like, it could see the food, but it was skewed. And it flew skew every time. But just went off course, because it obviously landed where it thought it was, but there was no food. Eventually it would find the food. What they found was, the more it practiced that, eventually that owl with the skew glasses flew straight to the food. So even though it was looking there, it was flying straight. So the brain can map and change certain things just by how the different chemicals fly around the brain. Again, pretty cool. Won't change your pain, but it's pretty cool. Number 2 is agitation. And this kind of falls in with the things get worse before they get better. But whenever you've tried to practice something, who's tried to play a new instrument here before? Okay. Who's had pain before? Everyone. Okay. When you try to do something for your body, your mind, you try to learn something, at first it's frustrating. So you just don't get it right, and your fingers spasm, and you just get angry. That's the brain releasing a hormone called noradrenaline. Okay, it's epinephrine if it's in the brain, but it's adrenaline, and it comes from a part of the brain at the base there. Gets released when you try something new, and the circuitry goes all the way to the front, speaks to the brain, speaks all the way there. So that drug, the drug in the brain, the neuromodulator, as it's called, attaches to the nervous signal, and it almost earmarks it for some change. Okay, hold that thought, because there's a trifactor that's actually needed for this. But when you try something new, a new movement, a new stretch, after a few days it feels weird and stressful. But keep going, because there's some method to the madness. So you need What was the last one? Thank you. You need agitation. Then you need focus. So you just have to focus on something. And again, this is all, every slide here is a talk for a different day. But focus is a cool one because babies between 0 and 5 learn from when they're born till the age of 5. They can learn different languages in different accents. They learn how to walk, stand, jump, everything that we can do, a baby learns in 5 years. Because it's got no clouded focus. You know, its primary goal in life is learn. Whereas us, we have stress. We have bills to pay. We have spouses or partners. We have work. Just so much stress and stuff clouding our mind that we just often can't learn quick enough. So if you start focusing more on making a change, you can. And this all revolves around the second chemical called acetylcholine. That also comes from a similar area, but just the base of the front of the brain. And its pathway is similar to the last one. Okay, but it also gets attached to the nerves, earmarked for change later. And the third chemical is dopamine. Who's heard the word dopamine? Cool. So yeah, so it's what happens in your brain when you get something that you don't expect. Okay? It's not just the happy hormone, it's not the likes on Facebook. It's the likes on Facebook where you expected 1 and you got 2. That happens to me all the time. I only get 2 likes. But when you expect 1 and you get 2, huge, crazy. When you expect 5 and you get 4, depressed. Okay, so it works in both ways, but it works when there's a prediction error. And I think this is probably the most important thing to understand today. If you have chronic knee pain, that first bend that you don't get knee pain will be like drugs in your brain. You'll be like, wow, that's pretty cool. And your body will crave that feeling and it will eventually try and get there, and it's going to go through worse inflammation after that. Knees always get worse before they get better. But that feeling of pain-free movement or pain-free anything in itself becomes a drug. And that helps the circuitry change better. Some research about that. A key essential of changing your brain is sleep. So once all those chemicals have been released in that certain pattern of the new movement, you have to get sleep. So again, this is a talk for a different day, but prioritizing putting things off at night and going to bed is so important. You know, just try to get more sleep than you're getting. That's a good start. Education. This is probably my biggest passion, is just educating people. And yeah, this is just 4 of the recent studies that show just education alone is treatment. So everyone attending here today, bank 70 quid. You've just treated yourself to learning about your body, and that alone is going to help you. So that's pretty cool. Number 7, make errors. If you've seen me, you've heard the word proprioception before. It's kind of balance exercises. So that's anything that you do to balance. And again, in the brain, there's a part called the cerebellum that controls all of our balance, you know. So the more you are unstable, the more the brain's going to want to learn that, because it knows that if you break your hip in the wild, you're dead. So anything unstable, the brain's going to learn that pathway very quickly. So we get patients doing some single leg stuff, and it just speeds up the healing process normally. Case in point. Number 8, we're almost finished. Number 8 is love. Stupid one. But they did studies in the States, and my little nephew always makes me cry. Weird. Brain's weird. So they did studies in the States, and just viewing a picture of someone that you love decreased your pain. So that's pretty cool, and it goes hand in hand with the next one, support. So the biopsychosocial model that we mentioned about 5 minutes ago, the way to look at a patient from every direction, one of the big mechanisms of that is support, you know, having just people around you, whether it's a spouse, a partner, a friend. Sometimes I become a patient's only support, which is really just sad, but it's a blessing for me sometimes. Because in that moment, my calling changes from, cool, let's treat pain, to let's just be a good person, you know? So that's a big one. And in closing, Mr. Ledger has to go. But in closing, yeah, so there's just three, I think there's a few take-homes today, but there are three big ones. Number one, we are adaptable and we can make a change. So your brain, I think we know now how pain works, you know. Your brain learns a circuit for pain, so therefore you can unlearn that. But even better than that, don't even worry about that too much. Just worry about learning something new. And the more you change and get a new pattern going of any sorts, whether it's seeing someone, chatting to someone, all forms of therapy are great because they just teach your body something else. So you can change, that's pretty cool. You've learned it, you can unlearn it, and then be patient or become one. So it all starts with just one step, one move, one glass of water. Doesn't really matter where you start, but what matters is that you just keep going. Thanks very much. My mom actually attended from South Africa. That always gets cool. We are done. If anyone has to shoot, please shoot. But if anyone has any questions, you're welcome to ask out loud, or you can ask me afterwards. Anyone have any questions?
What is the difference between a chiropractic and osteopath?
So we all treat the same things, right? We all treat pain, back issues, etc.
Yeah.
It's just different ways of getting there. Yeah. There's good chiros, good osteopaths, bad chiros, bad osteopaths. So I think we all get to the same place. It's just a different way of getting there.
Yeah, okay, thank you. So it sounds easy, but when you're in real bad pain, you know.
No, it's horrendous. Yeah, it's horrendous.
Yeah.
We see some hectic patients in pain, agony, can't move, can't do anything, you know. And some people just can't, you know. Like some people, our bag of tricks doesn't work, you know. I actually forgot to make a slide about it, but I've had patients before, and this is a real thing. They insert a battery package into the bum muscle, and they shove a electrode up the spine to the base of the neck, and it fires off little electric signals to try and block the pain firing going to the brain. So some people have tried everything, but the only thing is an electrical impulse in the brain just to short circuit that signal going up. So yeah, there is just some horrible, horrible cases. But the good news is most people respond, you know. That is the good news. Most people respond to whatever their therapist tells them, you know. Like if you just, I think sometimes conscious, but also just patient, you know.
So the exercise is very good if you can manage it and go through the pain.
Yeah, so depending on like what's wrong, sometimes obviously if it's really bad at first, sometimes we even just get patients to imagine movement, you know. Close your eyes and think about moving that leg again. Even that, they've shown will get the movement pattern in the brain firing, but your eyes are closed, you know. And again, that sounds silly, but then you look at my friend Adrian with one leg, and she had pain in her foot that was not even there. Yeah, it is really cool. Yeah, so that's called phantom limb pain.
I have heard it before of the army people
Yeah.
that had a lot of pain, but nothing there, you know.
I think it was in the news the other day, or the other year, sometimes lose track of time, but there was a British soldier.
Yeah.
They found a bullet in his brain from the war. You know, something ricocheted somewhere, went into his skull, kind of like spun around the skull, and because the entry wound was there and he didn't die, they just left him. years later, they found that bullet in the brain.
They couldn't get it out.
Well, it wasn't causing symptoms. It was an incidental finding. Yeah. It's interesting.
Are most of your subjects you discussed this morning in your book?
Yeah, so most of it's in the book in a different way, you know. Susan and I we're just speaking about now, but just how things are educated sometimes, you know. I think everything's in the book, but completely different examples and different way of thinking about it. Yeah, so my goal is just to educate and just keep on going, and something's going to stick in someone's head somewhere, and then that might make them want to make a small change. And it isn't even about the person or me or them. It's about fixing a relationship with someone around you. You know, maybe it's just about something else random that's causing something else. Maybe just be a better person. Who knows? But I find sometimes education is the best.
You are in the shop up the road there, are you?
Yes, didn't bring any cards, but yes, you know Days
I
Lane.
have walked past it a lot of times.
Yeah, that's our practice. Two of my colleagues are here. We have a very cool team there. We've got hypnotherapists, we've got massage therapists. It's pretty cool.
What do you know?
Oops. Asking questions. There's not much left to say.
Okay.
You could for a few years yet.
But yeah, I don't know why that's come up. That's me surfing in South Africa. Ignore that. Brilliant. I mean, if you have to, I can speak your ears off. But one example, I know a patient's brought her mom with fibromyalgia is just like one of those, like just the examples, you know, of chronic pain syndromes, chronic pain. And the research and the current treatment for it is just sometimes a little bit shocking, you know. And a lot can be done for those types of patients because it's often just something's been overlooked, you know. Something simple like just basic muscle work or basic spinal work. Something's been missed, and the person gets labeled with this chronic pain thing, which just makes things worse. Because you then have this mental image of, wow, I've got a real problem, and often it is just something not a real problem. But yeah, that's called the F word, where you don't speak about it. Not as bad as the C word. Cancer.
All right. I thought something else then. That's naughty.
Cool, guys. Well, thank you for coming. I'm going to try and do these every sort of second month. If you want to come listen to some education and some jokes, just keep in touch. Thank you.
Thank you very much.
Never gone back.
Yeah, very nice.
What's the next topic?
At least no one got the meal in the office. No. Thank you. I'll see you tomorrow. Thank you. How are you doing? Well, fine, thank you. Well, now, yeah.
Your seats in your car.
Thanks for coming, guys. Thank you. I should have spoken about you. Hey.
No, the thing is, what do I think on this about?
Thank you for coming.
Yeah, it's ridiculous. It's ridiculous. That's been a week.
Thank you for coming.
Nice to see you.
Nice to see you.
That's a good
Hello
one.
to there.
See you, Jim. You've got this.
Yeah. I've heard so much.
Have you?
Any better?
My sessions are just.
Any better?
That settles it there.
We have so much of this. What about people who start doing it yourself? Just like moving things. Rather than give you people. So just start moving, do as much as you can. See what causes your
What I expect.
yeah. Pleasure.
Thank you so much. See you next week.
Thank you.
See you.
This is my very nervous friend. It's hard. You're a neighbour.
You saw one today.
Yes, yes. That was really,
Cool.
I really understand it. I've always got diagnosed about 5 years ago, and they put me on gabapentin, and I've gone from 4 down to 2. Because what I say is you've got to manage it rather than you
100%. 100%, yeah. Yeah, I should mention that because sometimes pain medication is awesome. You know, it's sometimes you use it to get people moving,
Yeah, well, it got me.
and then you can move, and then you can slowly wean off. You know, but I mean, it's gold. Yeah.
But I'm right where I come why do you talk about the brain? Because I've got this balance problem, which when you start mentioning that, and it's in the morning, the brain's and it's becoming like big old spaces.
It's interesting.
Yeah, and that was really, yeah, I'm okay.
Cool.
I might expect you to be more personal one of these days. What we like was only 20 years.
Just before the next one, you've got all these happening.
Yeah, I was there today. And
Yeah, I'll tell her what you said.
Oh wow,
Yeah, it's true. Yeah.
interesting.
Yeah.
It was nice meeting you.
I
No, you. I'm saying. Thank you.
What are your partners?
know.
We're his great family.
Well, we get started.
Yes, sure. Lovely meeting you.
Take care.
We'll see you guys soon.
Yeah, see you soon.
Thank you for coming.
Bye.
Menace,
Bye.
See you later.
thanks for coming.
I was 16, and so coming on because I'm getting some break from the schedule.
That was good. Was it?
I think it is.
No.
It's wrong. Alex,